And okay, I don't know about the rest of you. I just got the recording in progress. Got it before I can see my screen. There we go. Doris, thank you so much for that introduction. And indeed, who thought that we'd still be having to be talking about another 50 years of cleaning up Hanford, the most contaminated place in the Western Hemisphere. When we began campaigning for the cleanup of Hanford, we thought we could do it in 30 years. And the Energy Department is always able to prove us wrong. So thank you all. Indeed, the presentation I'm going to give you, I want to give credit to the presentation was initially prepared and delivered this summer to the King County Medical Society and University of Washington Medical School by two of my former Masters in Public Health students, Molly Codding and Kara McCoy, who is also my legislative aide. And I've updated a little bit for today. So let's jump in to answer some of the key questions, starting with an acknowledgement that we are at the University of Washington, where I teach, on the land of the Duwamish, Muckleshoot, and Coastal Salish people. And we appreciate and recognize their rights, and that includes the resources that we continue to contaminate. Here's just a quick view of some of the agenda that I'll go through today. We're going to talk about why lead is such an environmental justice issue, the health effects of lead, indeed that inverse relationship. We'll talk about why we can't leave this to the federal government and how we can mobilize at the state level to make a tremendous difference. And indeed, that's where we're going to have to mobilize, apart from replacing lead service lines in the infrastructure bill. And we'll talk about why that is not nearly enough. So why did Washington need legislation, which is, I think, a model for the nation? First, to start with, there is no safe level of lead in water, period. Now, this becomes highly controversial. For 20 years, school officials across the nation have pointed to an EPA guidance that said change, depends which page they look at, either 15 or 20 parts per billion. So remember those figures, 15 or 20 parts per billion was safe for children. Why? Because 30 years ago, the EPA had a convening and discussion about regulation, and the water purveyors said, we can't do it. So how about you come up with not a drinking water standard, but instead a trigger level for if more than 10% of our household outlets are above level, we should go do something. What we'll do? Nothing specific, but we'll do something. If 10% of our outlets are above above a trigger level of 15 parts per billion, and for schools, their guidance was 20 parts per billion. Many schools then turned around, not having anyone who understood public health or risk assessment, and told their parents, children, told the pediatricians, the legislators, the water was safe if they had done any testing, and it was above 20 parts per billion. We're going to walk you through and show how horribly misleading and the ill effects of that. Plus the ill effects of saying that 10% of faucets in a community is adequate to test, because if you self-select those 10%, whose faucets are you leaving out? You could imagine it's not the faucet of a child on Medicaid who didn't get screened for lead in their home. So Washington, like most states, didn't have required testing for lead in its schools. The EPA, as I explained, does not have a health-based standard for lead. There is no drinking water standard for lead. It's a shame. As you know, drinking water standards are supposed to be set based on toxicological evidence and with a goal of doing no harm, and the standard itself based on a range of factors that prevents any observable health effects. We know that the observable health effects from lead begin at levels basically a tenth of that 15 parts per billion. That's why the American Academy of Pediatrics, based on the research, extensive review of all the research done on the uptake of lead from water to blood, has said the appropriate standard actually should be 1 part per billion. So in Washington State, working with Environment Washington and the statewide public PTA organizations and other groups and health advocates, we began pushing for voluntary testing of lead. And we found that a very high number of schools had outlets above 5 parts per billion, indeed a high number above 15 parts per billion. And this is a range of school districts in the Washington State, where, and the figure in the chart shows the highest level of lead in a faucet that children use. When we say faucets that children use, we include the kitchen faucets used to prepare their food. That's really important, not to just think about the fountains. So for those of you who are not familiar with Washington State, Neah Bay is on, basically includes a very high proportion of Native American children. And the highest level of lead recorded in the state was in a school there with 1,780 parts per billion lead in the water. These results are pretty shocking, but some of them are not from poor and high. We measure poverty in schools with free and reduced lunch levels. But North Shore School District, which I represent in a suburb of Seattle, had 500 parts per billion in one of its elementary schools. So low-income people are exposed through multiple sources of lead that the rest of America is not as exposed to. Now, we all know Flint, Michigan, and Washington, D.C., and the stories of the service lines and lead. But lead is not a problem solved only in the miles of service line leading to the home. Older homes have pipes with lead solder. And that's where a lot of the service line problem comes from. And a very large proportion in Eastern United States and older housing stock is from lead service lines. But even if we change out all the lead service lines, where people are living who are renters, they are almost certain to be in units that have older fixtures that have released significant quantities of lead in the water when the water sits for any length of time at the sink. So just fixing the lead service line is not going to solve the problem. It's necessary, and it's caught a lot of the attention, but we have to get the lead out of the fixtures. And I'm very pleased to say we've made some very good progress on that last couple of months with a upcoming adoption of a new national standard for fixtures. But you can see that African American children are 1.8 to 5.5 times more likely to have elevated blood levels because of multiple exposures. So some people say, why get the lead out of schools? It's coming from other places. Well, the answer to that is, hey, when we send our children to school, we expect them to come back having learned and grown, not having lost IQ from drinking the water. Secondly, it's easier to attack this as a major source and reduce the overall lead in every child's blood, at the same time targeting a major exposure for those people with the highest risk. So housing built before 1978 is where the greatest housing risk is. Who lives in housing built before 1978? Doris?
1912.
1912. But I'm willing to bet that you probably changed your water line somewhere in there to modernize it in the last 30 years, or have changed your kitchen faucets and bathroom faucets, because most middle Americans have, middle income Americans. But most people who rent are in buildings that do not have those updates. And that's why there's a great environmental injustice. So what are the effects of lead levels? First off, you need to know that there is we can model the relationship between level of lead in the water. Take a look at your age and ingestion and know and predict relatively well what the blood lead level is. And the health effects are all based on what we know about blood lead levels. So chronic exposure results in cognitive delay and permanent harm to cognition. Results in something that a lot of people don't realize: serious behavioral health issues. And a lot of the children who are exposed to high levels of lead are children who are then identified as having behavioral issues in school and are disproportionately put into given IEPs for special education services, but it doesn't address the cause, which is biological. And it affects emotional health. We also know, and it's very important to be aware of, how lead works, and I'm not going to go into this in great detail here, but blood lead levels accumulate and then build up in the bones. When a pregnant person is carrying a developing fetus, they release that lead from their bones. you're probably familiar with the fact that you release calcium. And as you do that, you're releasing the buildup of lead. So it has a very significant impact on the nervous system of the developing child. And that continues into a nursing child. And those effects are lifelong, and they can include serious neurological problems and stunting, as well as the cognition, behavioral, emotional health issues. So here's a picture of summary of where we're at here. At 10 micrograms per deciliter of blood, a child loses about 1.6 points of IQ as when it's been absorbed into the blood and remains there for an extended period of time. Remember, it takes a long time to reduce blood lead levels. There are cases where it takes 20 years to really bring down a blood lead level. Now look at this. This not a straight line relationship, and that's very important for people to understand, that for IQ in an adult, there's more basically a 50% increase in blood lead level results in a doubling of the loss of IQ. Let me repeat that. 50% increase only from 10 to 15 doubles the loss of IQ. But the inverse is true in terms of the relationship with perceptual reasoning and loss in working memory. But these are really, really important things to think about in terms of which children are exposed and have the greatest risk, and what that lifelong effect is as an environmental justice issue. So we're talking about how race is always a social determinant of health in the United States. And this is a prime example of that. And it's not just the determinant of health, it becomes a determinant of educational attainment. And that means the ability to succeed and break out of poverty. And it is intergenerational. Children are, of course, at greater risk. And so a 5-year-old child with, and now we're talking about 1 part per billion in lead level exposure. So that is in the water itself, increases the blood level by 35%. So remember, we're talking about people being told that 20 parts per billion or 15 parts per billion are safe. But for every part per billion, you get a very significant increase of 35% in the blood lead level. So you rapidly increase, and people say to us, well, why didn't you compromise the current standard that schools are being used, that the federal government is saying test for, is 15 parts per billion. Why don't you compromise at 9 parts per billion? Well, look at this figure and you see that a 5-year-old exposed to that extra 4 parts per billion that we reached at 5 parts per billion as a compromise, that's a very significant difference between 5 and 9 parts per billion. To a legislator, it's just the difference of 4. They don't know what that means. But in terms of health effects, it's very significant. And so we saw in Flint, Michigan, 13,200 micrograms per liter in the water reached. It's incredible. It's just, there are children whose lives will never recover from this exposure. And let's remember, water is just one source of exposure. I do a lot of work on Superfund sites. In most states, we do not regulate exposure in properly for Superfund sites. And who's exposed to where lead is? Lead is in the soils released from smelters, mining operations, and former farmland. We have schools with extremely elevated levels of lead in the playground soil due to area-wide orchard exposure, having used lead arsenate for many years as a pesticide, an herbicide, and from deposition from smelters and mining operations. And what is traditionally the case in state after state and with the federal EPA is that the lead level is for cleanup is not set the same way as other toxics. And basically it said, oh, it's so big, we're covering such a big area, we're going to allow a greater health effect. And so we've got children who are exposed to lead in the soil that they're playing in, whether it's their home or the school playground, and in the water at home, and then in the water at school. And thank goodness we got the lead out of gasoline, because that was the biggest harm by far, magnitudes greater than water, in terms of exposure of children of BIPOC communities and low income who disproportionately, of course, live near highways, because the highways were put right through their communities. And that lead exposure was horrifically high. So here we have another charting of the showing the maximum level of lead in Washington, 551 Washington schools. What we did to start this organizing effort was say, you can't tell us there isn't a problem if you don't test. So we insisted on getting funding to start with, testing every school, every faucet, starting with elementary schools. And then we could present to legislators, having organized meetings where environmental activists and health activists, pediatricians, and PTA parents would meet with legislators and say, look at the lead level in our schools. Our elementary school down the block has a lead level way up here. We need action. And that's what got us from incredible resistance to this to winning and passing groundbreaking legislation. It's the ability to start with testing, look at those tests and say, here are the results in the elementary schools in your legislative district. And Molly, our MPH student, did something that I've never seen done before in a legislative lobbying campaign. She prepared a memo for each legislator in Washington State Legislature. And as the bill came forward into each committee, we gave each legislator a memo showing the test results in the elementary schools in their district, which invariably included some that had really high lead levels. And they looked at it and go, that's my school? We had one legislator look at it and go, I went to that elementary school. My grandchildren go to that elementary school. We got to do something about it.
Right.
And the school district was sitting there in front of them saying, no, don't do anything. School districts were our biggest opposition because they did not want to do anything. They were afraid of the cost of remediating lead, even though we kept saying we will pay for the cost of remediation. The cost of fixing a faucet, changing out a faucet, is only about $85. Adding a certified filter to take you down to 1 part per billion or less in the water, $25. Maybe 50 if you go for a fancy one from, and you don't get it at Home Depot. I shouldn't say any particular store name, but that's
big box store.
Big box store, yes. So you see here, we had hundreds of schools out of 551 tested, 335 were over 10 parts per billion. And 271 were over that 15 part per billion. So that was the level at which EPA was saying you should do something. What you should do, they didn't say. Often it was run the water for 30 seconds before allowing children to drink. So what's the matter with the federal government's action? For years, there's been a battle going on to get the federal government to act, and including all the major environmental groups in the nation, and revising the federal lead and copper rule. Again, the federal law doesn't include a drinking water standard. It doesn't have a maximum contaminant level, which is what we're used to under the Clean Water Act, Safe Drinking Water Act. And they do recognize that the goal, the contaminant level goal, is 0, but they don't have a regulatory standard. And then after years of fighting, the new federal rule came out, and it only requires testing in 5 outlets per school. And that's what California had adopted, which made it politically feasible for the Trump administration to propose 5 outlets per school. It's a travesty. Which 5 outlets are you going to choose? There are typically, in a moderate sized elementary school, 50 outlets. Testing 5 is ridiculous. And of course, it introduces a lot of bias, because chances are the school will go to the new bottle filler station that they put in, rather than the old faucet in the back of the kindergarten class. And the federal rule doesn't require you to retest. Our state law says you've got to retest every 5 years. Got to keep this up. And there's no federal support for remediation. And that's a big deal for strapped school districts. So what we did was we drafted a law, and that says every public school in Washington State has to be tested between now and 2026 over a 5-year period. And then every 5 years, it has to be retested. And then we said, we're going to require you to change the fixtures and reduce lead in the school building to below 5 parts per billion. We're going to rely on parents to put pressure on to say if it's above 1 part per billion. And that's the one weakness in our law. It would have been better if we could have gotten it down to 1. But 5 is the FDA's drinking water standard for bottled water. And now that's based on adult risks, not children's risks. But it became very hard for our opponents to argue that they should allow water in children's schools above the level allowed by FDA to be in your bottled water. And we hope that we'll reduce that down to 1 in coming years. As still, it's, I think there's only a couple of jurisdictions in the nation's cities, not states, that go below 5 parts per billion. And second, lastly, we say our state public office of superintendent of public instruction is funded to pay for the remediation, which averages about $3,000 per school only. And we've had all these, school districts saying it's going to cost us hundreds of thousands of dollars to, that we should be putting in children's education instead of changing water faucets. And our response is twofold. 1, preventing a child from losing IQ, having permanent memory and deductive reasoning impacts is education. Number 2, it's actually really inexpensive. Unlike the horror stories of what happens if you have to change out your lead service lines, which are very expensive to change out. So we got this done, as I said, by working with parent groups, environmental groups, and building a support with our teachers union in Washington State, and pediatricians and public health agencies. But it took years of work, and we said, let's start with, it will build the case by getting the test results. And that's what tipped the scales after years of advocacy. And having activists sit down with legislators and say, my kid goes to Green Lake Elementary School, and here are the test results. So there are gaps in our lead screening. Medicaid children are supposed to be tested for lead. The rates of testing in some of our states, including Washington, are abysmally low. And that's why we gave this presentation originally to King County Medical Society in conjunction with our pediatricians, because we need to get lead screening done for every child on Medicaid. And you see very low primary care screening in Washington State. So a lot of medical providers don't understand how important it is to test. There are many barriers to primary care and testing. And there's a lot of mythology out there that if a child does not exceed 10 micrograms per deciliter in their blood, that there is no harm, which is very dangerous and false. At 10 micrograms per deciliter, we know that a child is suffering irreversible behavioral and cognition developmental effects from lead. So this is for the medical community screening. And where we go from here in our advocacy in Washington State, now that we've got a program in place for public schools, actually private schools as well. Let me just say, private schools are awful. They don't want to test for lead. But our next step is we're making a decision as to whether or not we have a program to go to child care centers and preschools, or do we invest in neonatal home visits and prenatal home visits with a community health provider who also would look at both your lead levels and your dust and asthma trigger levels, and provide support for changes in the home for both lead and other health interventions for a newborn. Or do we go to childcare centers? Problem with childcare centers is that so many of them are private and are in old homes and buildings. And we have a lot of issues about whether, letting people in. There are issues about equity to test. And then how are we going to pay for the remediation? Now, I would say we ought to just step up and pay for the remediation in a home if children are there. But there are many legislators who don't want to pay that bill. So that's where we are in terms of where we go from here. And at the federal level, the new faucet standard that has been negotiated for years is going to take effect, and California is coming in behind it, and it will require that the faucets fixtures not release lead at levels that would cause more than 1 part per billion in the water instead of 5. Now, what we've seen from the last reduction 20 years ago is that it takes 20 years to even penetrate into school buildings, et cetera, for a lower lead level to replace faucets. It takes more than 20 years. So just having a standard doesn't do anything to change that, especially as an environmental justice issue. It doesn't change it for the children at greatest risk. Let's face it, who's going to live in brand new housing? People who already are at lowest risk. So that takes you through, and I'll be glad to answer questions. And I'll stop sharing here.
So we want everyone to stay around. If you've just joined us because you were following the agenda, we have some announcements. Our first speaker yesterday afternoon told me he was going to go to Spain, so he couldn't make a presentation for us. So I scrambled, and I do have some things about Newark. But one thing I did want to talk about and have is a poll so we can catch people who may be interested in working on lead. It was to be introduced after the lead pipe thing, and because we have so many billions of dollars, hopefully appropriated for that kind of thing. And then Lee, go over what Gerry is saying after the poll. So Gerry was going to talk at the half hour, but he's already given his presentation, just to keep everybody on who comes in and out as to what's going on. So I'm going to launch a poll. And it's what activities on replacing lead pipes in drinking water service lines?
20 years, a lead and copper rule that is this very inadequate EPA regulation of lead. And it is still, it has been updated, and it is apparently going to go into effect this December. And the update from EPA is equally inadequate. NRDC and other groups have pointed out the weakness of this. So that's one thing about the federal rules, is they are not helping us yet. They will not be good enough on child care centers and things like that. We could probably send, if people are interested in working on this, it is my hope that the Sierra Club Toxics team will take this on as an issue. The Sierra Club Toxics team is authorized to work on issues like this, and we already have a document on lead in schools. And so I think we will write a new one, and we would enjoy working with anyone who signs up to continue to be interested in this issue. There may be other groups starting to work on this, but I think the Toxics team really wants to work on the issue of lead in fixtures, because that law, the new law on lead in fixtures, is better, but it has to go into effect sooner, which California has done. And we have to tell people that they have to ask for these better, cleaner fixtures, so that the industry that makes decent lead fixtures will get the business and can prosper. We want those businesses to do well, but citizens have got to ask for better fixtures. I don't know what else.
I can talk.
Wanted me to say.
Yeah, I understand. Maybe this will come to, first of all, something that didn't launch the first time. Thanks for telling me. I was wondering why nobody was checking things off. And also Doris and Gloria and whoever's a co-host, you can't participate. So yes, it does say contribute to a position paper, and it does say evaluate legislation. And I do mean anything at the federal level, like Doris said. So it's more for evaluate federal rules on drinking water as much as it is on evaluating legislation. So if anybody in the room has a law degree, we'd appreciate it. Some help. The work with local drinking water providers. When I started listening to what Health and Human Services was going to be doing to issue this $1 billion that's been in these COVID legislation to help people with their water bills. And Health and Human Services was doing all these Zoom calls and explaining all this stuff about it and how you could do this and you could do that. So I just decided to show up at my Drinking Waters Executive Committee. So luckily I knew who the chair was. I knew of him, and I knew he was a well-respected member of our community. So I introduced myself, and they were just happy to see me. And yeah, we'll work with you to figure out, because we have a community service agency here in central Iowa that called Impact that does the lye heap. So they're going to be doing the lye WAP. So I told him that. I told him I knew that Health and Human Services was going to be doing this, and they were all real happy. So afterwards, I went up to the guy who's in charge of the whole business, and I said, how are you going to know what service lines to replace? And he said, well, we know when we put them in. So and I've heard that's not so easy for some people to say. Some drinking water people have lost their records, blah, blah, blah. So that's the kind of thing I'm talking about. At a general meeting of the executive committee, you could just go and hang out and find out how they talk about all the money they have to spend and all the stuff they got to do. So that's the kind of thing. And if you want to give a phone call to the executive director of your water service, and say, hey, I'm interested in all this money that's going to go to community service organizations to help people with their water bills. So it's usually not the service. If they're on top of things, they've had a community service organization help them with this. So I got to learn about how the county knows about our community service organization, the city knows about our community service organization, and the drinking water people all know I asked one of my city council members while she was campaigning, I said, have you had any complaints about people getting their water shut off? And she said, no. So I think our community service organization is doing a good job here in Des Moines. I knew at one time you could get $160 to help pay your water bill. And it's not as expensive as it is in Seattle, Elaine.
Okay, I can't defend Seattle.
Yeah.
So
Yes, you
Debbie,
can. You can. She made a big deal about saying they can defend. They can, excuse me. They can. They'll reduce some people's water bill.
50%, yeah.
Yeah. So it's like, let's tax them and then reduce it by 50%.
We're not ready to do questions for Gerry yet then? Are we still doing the poll, Debbie?
Well, we don't have questions for Gerry, but we are recording things. And I just have the word, discussion. I'm going to end the poll real soon. There's 11 people. Anybody want more time? I'm going to end the poll and I'm not going to share results. And you can write questions in the chat or raise your hand or talk out like Debbie likes to do.
Well, I would like to tell a story that is a real story about lead in drinking water, drinking water in schools. I was a principal of a small school in the Seattle School District. The building was 100 years old. Now, this was way back 25 years ago. And I suspected that the drinking water wasn't safe, and the school district was not testing. And so I asked them to come out and test, and they said, it's just like Gerry said, oh, let it run for about 30 seconds or so. I said, no, that's not good enough. That's not safe. So we took our budget, and Gerry, this was our supply budget, which is, for paper, pencil, books, and that kind of thing. And we got a contract to bring in bottled water. So we had a great big bottled water dispenser in the school office. It's a small school, about 150 kids, so it was real workable. I'm not in favor of drinking bottled water, but there's a whole lot better than drinking from the faucet. So for 2 years, we paid for it. And then I got the facilities department to pay for it. Meanwhile, there was a parent from an elementary school who had come to the monthly school board meetings with a small vial of very dirty water. And he said, this is what my child is drinking. And he'd come every month with this vial. And the school board's response is just like Gerry said, we're meeting EPA standards. And so they did nothing. And that went on. I mean, we may have been the only school that went out of the way to buy our own water and then get the school district to pay for it. So this is real. And I really want to applaud Gerry, whose district is just north of my district, for taking, for getting this forward. And I hope that other states will want to learn from what we did in Washington State.
I'm really glad that this, are we still recorded? I don't know if we are still being recorded.
Yes, we are still being recorded.
Yeah. We need to share the recording with lots of people. I have worked for 30 years with a woman in Kellogg, Idaho, where their drinking water is contaminated, their soil is contaminated from lead smelters and lead mines, and their health department is not much help. And I want her to see this and maybe share it with some of the health professionals in the Bunker Hill Superfund site area. There are some places in America where people still live in contaminated communities. And it's really important that Gerry has pointed out what an environmental justice issue this is. So let's be sure we all have access to the recording of this workshop.
Mike Carberry has his hand up.
Thank you. I have a question for Gerry, and thank you so much for your presentation. Very enlightening. My question is, you had mentioned Hanford a couple times, and I'm on the Nuclear Free campaign, the grassroots network team. What can you tell us about radioactive isotopes and other radioactive contaminants in the water in the state of Washington? not just lead, but the things that could make us glow at night?
Well, I could give you another couple hours of presentation on that. While we're talking right this moment, for those of you who don't know, the Hanford Nuclear Reservation is where the United States made most, like 90% of the plutonium for nuclear weapons. And there are 9 nuclear weapons production reactors along the Columbia River that have closed, but are still contaminating the soil around them, or the soil is still contaminated around them, leaching into the Columbia River. So we've got strontium-90 plumes entering the Columbia River right this minute while we're speaking here at 1,000 times the drinking water standard. We have chrome-6 at levels that are known to be lethal to developing Chinook salmon fry in the last salmon spawning grounds on the main stem of the Columbia River. We've got high levels of uranium entering the river, numerous other contaminants, and rather than the projection getting better, it looks like it'll continue to get worse over time as the Federal Energy Department that runs Hanford is currently, and we're running a campaign on this right now, there's a high level nuclear waste tank leaking into the ground, probably 100 gallons of high level nuclear waste a month, and the Energy Department refuses to do anything, and the State Department of Ecology refuses to do anything. So conditions getting worse. The Energy Department, NRDC, my organization, tribes have said we will sue the Energy Department if they continue to try to reclassify and call high level waste something else, that they can abandon it in the ground at Hanford next to the river. So that's the picture there. We have tremendous issues of water quality in the lower Columbia River and in Puget Sound and its tributaries. And of course, a major fight over the fact that there are 4 dams on the Columbia River. People don't think about the heat pollution, but 4 dams that basically turn the Snake River into a hot water bathtub, and there's no salmon passage, and it's lethal to salmon. And so those are some of the issues we've got.
Thanks for sharing, Gerry.
Yeah, sorry, that was not a very optimistic picture.
No, I didn't think it would be.
If you want more information on Hanford, the organization I run, Heart of America Northwest, you can go to hanfordcleanup.org, hanfordcleanup.org to get more info and send a letter to our governor.
And you can also join the organization, which I've been a member of for a long time.
Thank you.
We also have a comment in the chat, and I'll just go ahead and read it. But if Anna wants to jump in afterwards and add any thoughts, she can do that. I have not been following the issue of lead in DC very closely, and I know there are many advocates in DC working solely on this issue, but I think our chapter is having difficulty determining the effectiveness of programs offered in DC to help homeowners pay to replace the private side of lead lateral. If anyone has any advice for community members to gauge the effectiveness of our agency's lead pipe replacement programs, meaning the people that need the funding to replace the pipes are aware that these programs exist and can take advantage of these programs, I think she's looking for our collective feedback.
We had hoped to hear from a speaker from Newark, which a city that took action and funded the replacement of most of their lead service lines through aggressive citizen action led by the speaker that we couldn't have today. But we can post some information about what is done in Newark and perhaps in some other cities. The hope is that the federal infrastructure bill that is still being debated in the Congress will have adequate funds for the replacement of lead service lines. This is mostly going to help all those cities in the East and Midwest that have lead service lines. Out West in Washington, Oregon, we have very few. My city does not have lead service lines. The lead in my house, which is excessive and being tested monthly because it's high, and we should not drink, is from my faucet. So in DC, I think you might also, once we get more information about lead in faucets posted, you might want to add that to the efforts in the DC chapter. It's a very good chapter. DC chapter is important because it's the nation's capital. And you have a lot of people who live in DC who may be legislators or have homes in DC with lead in their water. So I hope the DC chapter can have some success here. But I hope we could help them by letting them know at least what some other cities are doing. Detroit has done some replacement and some other Midwestern cities. And what we should do is try to get posted some information. And if people have signed up to our poll today on doing more about lead service lines, perhaps we could send out a listserv for information on this. All people, if we set up a listserv, people could share information, and that might be the way for all of us. Some of us are new to this issue and new to each other. So it's a challenge to get us all working together, but maybe this workshop will help get that started.
So I have
Thank
some
you,
comments to
Doris.
answer her. So you talk about working with frontline communities. So that there are other organizations that work on this. And that's, we encourage people to work with them and come, like the Jimenez principles, find common ground and work together. The effectiveness of the programs offered in DC, there are a couple things that Newark did that, according to what I heard from the very beginning and the Times article I was going to give you guys, backed this up. They changed the laws, the zone, not zoning, but laws of the city, that homeowners were required to allow their pipes to be replaced. So that is kind of like a big thing. You know, I'm sure they had people coming in saying, I don't want this in my neighborhood. I don't want my lawn chewed up. I don't want this. I don't want that. You know, so it took some political will to change the law in Newark so that people had to have the line from the street to their house replaced. And then Newark got a lot of money from their county. So that's the Times article implies, and I inferred that the county that Newark was in really helped with giving them the money to do that. And then another thing that the article mentioned, that, you know, my dad worked for a drinking water supply, so I know there's a lot of construction crew work. They would pull the lines out instead of digging up, spending the money, spending the time, spending the labor, digging up the whole length of the service line. They found a way just to pull them out. So that was supposedly something that increased how fast they could do it. I don't know if it decreased the cost, but that's what the Times article said was unique about Newark.
Thank you, Debbie. I saw before that John L. had his hand raised. If he wants to come back, that'd be okay. And Mike, you have your hand raised, but I don't know if that was from before. Okay, awesome, thank you. Did anyone else want to add anything on Anna's comment?
I wanted to ask Gerry if he is working with other states, and is he willing, how willing is he to work with other states? What would that look?
Indeed, we're working with activists across the country who are looking at action in other states, and a lot of organizing. We've been working with NRDC and Environment US, which is associated with the PIRGs, and their staff providing expertise to organizing efforts around the state. So there is legislation pending or being considered for introduction, and lobbying campaigns being put together in a number of states around the US. And there was quite a movement in California, which included ballot initiative, but I think a lot of people in California don't realize that what was ended up being adopted is quite weak, with like five faucets per school. So I think the other thing is, with the discussion in the infrastructure bill, I think there will be a lot of greater awareness that we have to replace lead service lines. We have to replace the line from the property line into someone's home, which is not typically paid for with public dollars. And that's the issue with Newark's model program. And then people will realize that, well, we still have a problem. We've got to deal with fixtures. And even where there are no lead service lines, which is in Washington State, we had, out of the first 551 schools tested, there wasn't one with elevated lead coming into the building. So we don't have a lead service line problem in Washington State. All the problems were in the building at the fixture level. So I encourage you to work nationally with those other two organizations. There are probably some others working together to try to put together state by state legislative efforts in addition to the federal effort.
So mentioning state by state, Illinois made the environmental press because of their passing of legislation. Nicole, do you know anything about that?
Yes, we passed the lead service line replacement bill with no partial replacements. They're all full replacements, as House Bill 3739 passed by let's see, Representative Lamont Robinson. Let's see, I don't have the bullet point details of that legislation in front of me. So
well, you're gonna show up for some meetings, so
of course,
be prepared to send it around.
Will do.
Gloria's from Illinois. She just gave you a thumbs up.
Great.
So Gerry, if we find out that we really have people who can commit to the time to do this, I know we'll get back in touch with you. NRDC does show up at some things that I'm on, but they're not, as far as they can contribute to the group, but they do have I think a red line about showing up for our meetings of our own. So again, that's why I ask if it's going to, and I don't know anybody from Environment America. So if we find there's enough people interested in working state by state, we do have a state program. And again, since Nicole is a part of that program, we could be doing a lot, or we might not have the bandwidth or capacity to do anything, but we hope we can do a lot.
And I think that the organizing efforts are eager to add partnerships, and my observation would be that they've been weak at the grassroots level and need the help that Sierra Club could add. And one of the things that also, what we were able to do is take it from beyond, the membership of a couple of environmental groups to say, in order to win this organizing effort, we need to involve the educators, teachers union, other educators. We need to go to mobilize the parent-teacher associations. So we did presentations and got the Washington State PTA to adopt this as part of their legislative agenda. And that's, that mobilized a big chunk of people that we don't usually reach in our organizing efforts.
Yes, we do believe in having partners and allies.
Yeah, that's how you win.
Oh, I do have the handout for the lead service line replacement. If I can read it for people, that's okay?
I think Esther's nodding her head yes.
Okay, all right. All right, the Lead Service Line Replacement Notification Act, it requires municipalities and water suppliers to find and replace all lead service lines, prioritizing vulnerable populations such as lead burdened communities and child care facilities. And it creates the Lead Service Line Replacement Fund, which would enable full lead service line replacement for all Illinois residents, regardless of income. It sets a fee based on water usage and ability to pay. It directs the Illinois EPA to work with government and non-government stakeholders to design a dedicated fee. A portion would be dedicated to a water bill assistance program for low-income communities. Another portion would be dedicated to water innovation grants, which would provide communities with funding to address other water infrastructure needs. And it also funds the Water Workforce Development Fund, which would provide grants and programming to specifically train foster care alumni, returning citizens, which are formerly incarcerated, and those from environmental justice and low-income communities in water infrastructure trades. Sorry, I didn't have that much detail off the top of my head.
That's okay. I mean, I just, me being in my big mouth, one of the things that I learned quickly is that there are social justice issues associated with people not being able to pay their water bill. So, and here in Iowa, the press made a big deal about a guy learning to be a barber while he was in prison. And now he has a shop. So hearing those kinds of things mentioned in that bill are things that I think we normally don't think about as something that can really help people pay their water bills.
Mm-hmm. Exactly.
Has that become law in Illinois, or is it a bill?
No, it's law.
It is law in Illinois.
Mm-hmm. Mm-hmm.
It's very good.
Yeah. Mm-hmm. Yeah. And so it was sponsored by Representative Lamont Robinson and Senator Melinda Bush.
Thank you so much for giving us the details on that. like I would have to read it again to be able to fully take it in. But it does sound like they make mention of some of the things that Anna was talking about with, I think what she means in the end of her comment is the outreach, the necessary outreach to make sure that people know that programs exist and how to take advantage of them. Because, you know, the funding is great. Funding is wonderful. I mean, nothing can get done without funding. But if programs are offered to the public and the public doesn't know about them and they don't know how to take advantage of them and they need help with that, it sounds like with this new law that maybe hopefully they'll bridge that gap between.
Sure.
Well, and that's one of the things that happened in Newark, that people wanted this to happen for such a long time and it didn't, that when it finally did, there's still mistrust built up. So I know that Willa, was that a mistake for you holding your hand up?
No, I had a question, but it was a little bit off of what we were talking about. So, you know, I obviously feel the need on a statewide basis to go through and do something similar to what we've been talking about. But I also know that there's a whole lot of data that you collected, Gerry, to just really support, you know, what your desires were to remediate and to do your project. Sorry. So I just wondered, you know, how did you pull in the information? You know, did you have a grant of some sort that you're able to get people to do some research and get this information? Because I think, you know, I'm thinking about Florida, I'm sure, you know, we would need to do some kind of a statewide data collection on schools, and that would be, that's a lot.
So I think there's a great deal of, you know, organizing useful literature, summarizing the research about children's exposure and schools now. And using that in a state like Florida to say the first step is we want to know what the heck the lead level is in our children's schools. And yeah, the feds say that we have to test 5 faucets per school over the next 5 years. That's inadequate. To organize for the state health department to come in and test using the EPA testing protocol, just like making sure that you're all taking the sample the same way, test every faucet that children use and create a database. That'll give you the organizing power to go further, because I guarantee you'll find outrageous levels of lead then in every legislator's district. But so that's the data that need, and our secret to success was saying, let's stop talking about this in the hypothetical. Let's get funding to begin testing. So we've got 2,800 public schools or something like that in Washington state. When we reached the test results we had for 551 elementary schools, that was adequate for us to push this whole bill through, including testing the other 1,500 schools over the next few years. So, look for a champion or two to simply say, let's put a little money in to test every water faucet. We put $1 million in the budget to test 550 schools in a 2-year period.
Thank you. And so you went through your basically your state health group.
Right. Right, we didn't want to trust the school districts to do this, so we said the state health department would have a few people who went out and did the sampling and run the tests at the state health lab. Frankly, it probably costs more to do it at the state health lab than just sending the results out to a certified private lab. Running the test is about $25 per sample. So if you collect the sample using the right protocol, and the lab test is about $25 only for each faucet. So, you know, for under $2,000, you're testing all the faucets in a large school.
Thank you.
And let me just add, the other thing is, you know, in terms of expertise available, you know, and mobilizing experts to testify, which is what we were able to do because I teach at the School of Public Health, the University of Washington, and had public health graduate students to compile. There's no lack of, at your major universities with public health departments or departments of epidemiology, you'll find people who are eager, and especially if the pediatricians will mobilize them for you. They know who to go to. So go to your local pediatrics association. They're on this. They're advocating for 1 part per billion, and they'll join you and they'll give you the expertise you need. And there is no better messenger in front of the legislature than a pediatrician.
Mm.
Those are great ideas, and I really like the one of going to a College of Public Health, which Tampa does have, and actually I'm a graduate of, so I
Great.
love people there. So that's a great idea. There are always people looking for projects and theses and whatever. Thank you.
Gerry, what was it when there was some pushback? What was the nature of the pushback? What were the arguments? Just that EPA had a certain standard, and that was it money or what was it?
So the horrible EPA, it's not even a standard, but it's misrepresented as a standard, is abused by school officials to say anything, why should we go below 15 parts per billion? Everything is safe. And that's going to remain the same problem with the Trump December 2020 lead and copper rule, which stuck with 15 parts per billion. And so, but school districts just don't want to spend the money. I mean, we literally had, you know, the superintendent of one school district and a board chair of the school board saying, if we do the testing, we're going to have all these mad parents show up at the school board meeting demanding we do something. God forbid. And so that was one source of opposition. Quieter but effective, there are opponents of tightening the standards from local water district purveyors. They have been fighting against a meaningful lead standard since 1991. So we have to overcome the local water district or city. They do not want a real drinking water standard for lead. And you can understand their rationale. All these lead pipes are there. Are they, you know, the federal government isn't paying for replacing them yet. What are they going to do? And then there's building industry and other opponents who were quiet behind the scenes, and we've seen this in other states as well. Not so vocal up front, but mobilizing the others because they are afraid of having the standard, a tougher standard applied to them, including private landlords who don't want it applied to them. And then private schools were just abysmally abhorrent and unconcerned about the health of their children.
Two things. Some states, and I'm sure as a state legislator, you know of this public policy of not to have stricter standards. So technically, there are guidelines that are used for drinking water that are not standards. The law language between a standard and a guideline and I know there's drinking water has its own initials.
Right. So we're used to thinking about water having a maximum contaminant level, which is a standard, drinking water standard, DWS, or a maximum contaminant level, MCL. And lead is one of the few toxic substances which does not have an MCL. There's an argument that can be made, and some of our national allies have made this, that EPA is actually legally required to adopt an MCL. And instead, in 1991, EPA, under pressure from all the water districts around the country, said, we're going to adopt this half-assed program where we say, if you have over 10% of your tested outlets above 15 parts per billion, then you have to adopt a program to control corrosion in the water system. And it's not really enforced, and it's not effective. And the corrosion control can actually make things worse. And it doesn't guarantee that, Gerry Pollet's home is actually ever going to be reduced below 15 parts per billion.
So I guess my second question is a bit picky, but maybe since we're deep diving here, you use the word private, and I am from St. Louis, so there were all sorts of private schools in St. Louis, Lutheran schools, Catholic schools, country day schools. So are you referring to parochial schools, or are you referring to really, really private schools?
Parochial schools and other private schools in Washington, dead set against doing anything at all. Lobbied to get out of it.
Good to know.
Yeah, I mean, we have an association that includes the parochial schools, but for the most part, it is funded by the wealthiest private schools that was opposed to this. So, like, the private schools where Bill Gates's children are are opposed to testing for lead in school water.
Yeah, I know probably most Sierra Club members live in communities that have that diversity of wealth at the upper end. So I thought I'd make a point of it. If we're done, I think we've gotten as deep as we can possibly go here, and so I appreciate everybody hanging in there and being flexible. And one of these days, if somebody doesn't show up, you'll get to see all the rest of the videos I promised. So I appreciate everybody hanging in there, and we'll contact you one way or another. if you've said so in the polls.
Thank you, everyone, and glad to be